This video is how Medicare supplements work in 2026. They don't really change much. It's pretty much the same every year. If you haven't watched the first video, it's only 5 minutes. I suggest you do. It's how Medicare works 101 for 2026, linked right below in the comments. So Medicare supplements, they cover portions of or most of what Medicare doesn't pay for. Those are Medicare approved services that they're not paying at 100%, where there's some percentage you are responsible for or some copay. I'm going to go over these. Now, first of all, if I told you that you could have a plan, if you weren't 65, if you were 50 or 40 or 30, you could have a plan where you could use virtually any doctor. 98% of doctors accept original Medicare. And you can go to any hospital, 98% of them accept original Medicare. And after the deductible annually of $283, that you would have no copay, that you would have no responsibility for any Medicare approved service. If I told you that you could have that plan at a reasonable price, my guess is almost everybody would have it. I would certainly have it. That is available to you when you turn 65 or when you go on to Medicare. It's called Plan G, and I'm going to talk about it. Okay, maybe you have seen this chart before, maybe you have not. This comes from Medicare.gov. It's on many different websites. Years ago, Medicare standardized all of the Medicare supplements that are available. They're issued by private insurance companies, and they're named by letter. And I'm going to go through a few of these for you right now so you understand how it works. Now, on the Part A, we talked about the $1,736 first day Part A deductible, which covers you for up to 60 days in the hospital, even if it's just one night. We talked about the $434 per day that starts at day 60. And we talked about the $868 per day that starts at day 91 through 150. Those are the lifetime reserve days. So any of these programs that cover what's highlighted here, the Part A deductible and the other benefits, cover all of those items, and they add an additional year in the hospital if you exhaust Medicare's 150 days in the hospital. I like the Plan G. The Plan G I like because it covers almost everything that Medicare approves of that they don't pay in full. The other thing we talked about on Part A is the inpatient rehabilitation, also known as skilled nursing care. As I said, the first 20 days, there's no copay, but from days 21 to the maximum of 100, the copay is $217 a day. Any of the plans with the green check mark aligned with this skilled nursing coinsurance pays the $217 a day for you. You cannot believe how often that comes up, where somebody's broken a hip, had a stroke, had a heart attack, and they require time inpatient to recuperate so they can go home again, even if they have help at home. We talked about the Part B deductible, the annual $283 deductible. No plans except for FNC cover that, and they are only available to you if you first were eligible for Medicare prior to 2020. Again, this is why I like the Plan G, because everything else that Medicare approved of is basically covered. So the 20% after the deductible, Medicare pays 80%, you're responsible for 20%. That's covered under any of these plans that have the Part B coinsurance highlighted. Part B excess charges are also covered by the G plan. These are charges above 100% of what Medicare may find approved. Although they're rare, it's nice to have the coverage if it's feasible. For those of you who don't know, I'm Aaron Bodette. My son Travis and I run MedicarePrepare.com, where we help people find the right health insurance plans for themselves with Medicare. Here's our contact information if you'd like to go further into this. And please stick around, because the next video in the comments, we'll talk about how Medicare Advantage plans work and should or should you not have one.